Failing to recognize the significant cultural and medical differences within the NHS could lead to a disaster for you and for your patients. Overlooking the medical culture of the NHS is a common mistake that can lead to challenges that go beyond mere clinical knowledge. Fitting in is just one piece of the puzzle. It's about ensuring patient safety, maintaining professional standards, and thriving in a system that operates differently from where you may be used to. Let's talk about why mastering UK medical culture is essential for your success. As an overseas doctor myself, with well over 2 decades of experience in the NHS, I can say that starting a medical career in a new country is not only a professional challenge, but a personal one too. You've already achieved a lot by completing your medical training overseas, and now you are taking a crucial step by joining the NHS. The key to making this transition smoother is understanding the unique aspects of the UK medical culture, which is quite different from the healthcare system many of you used to. So why is it so important to focus on medical culture? Well, the NHS is one of the largest healthcare systems in the entire world, serving millions of people from diverse backgrounds. Its guiding principle, shaped by values like universal access and quality care, drive every decision within the system. But that's not all. You'll find that the NHS operates within a very specific set of structures, processes, and policies that may be unfamiliar to you. This covers everything from how medical teams are organized to the way that we interact with patients. One of the first things I always advise overseas doctors to do is to get familiar with the General Medical Council, or what's called the GMC. The GMC plays a critical role in setting the standards for medical professionals in the UK. They ensure that patient safety is always the top priority, and as such, you must adhere to the GMC guidelines to maintain your registration and continue practicing in the UK. But adapting is not just about following guidelines or learning new policies. It's also about understanding the culture of collaboration within the NHS. Working in a multidisciplinary team is common here, and every team member plays a key role, from doctors to nurses and allied healthcare professionals. You'll find that patient care is much of a team effort, and communication is the heart of this collaboration. Now let's talk about the elephant in the room, cultural differences. Whether it's how to communicate with patients, how decisions are made in clinical settings, or even how colleagues interact, culture plays a huge role in how healthcare is delivered. Coming from a different country means you'll likely notice differences in how patients express their symptoms or expressions. Some patients may be more reserved, while others could be more direct. Recognizing these variations can help prevent misunderstandings. For example, in the UK, shared decision-making is a big part of patient care. Patients are often very involved in their treatment plans, and they expect their doctors to listen, explain, and give them options clearly, and offer them choices. And this may be different from healthcare systems, where the doctor takes a more directive role in decision-making. Understanding these differences will help you build a better relationship with your patients. Then there are the day-to-day interactions with your colleagues. The UK workplace culture values politeness, clear communication, and mutual respect. There's an emphasis on addressing issues diplomatically. If you are used to a more hierarchical system, it might take some adjustment to a more collegial, often informal dynamic between doctors and other healthcare professionals. And this is one area where many overseas doctors feel need for extra support. Over the course of our videos, we'll dive deeper into how to navigate these cultural differences. I will share examples, practical tips, and advice that will help you avoid potential missteps. For instance, we'll discuss how to handle difficult conversations with patients or colleagues, how to manage time and workload efficiently, and how to remain patient-centered in your approach. This is an expectation that's the core of the NHS value. It's also worth noting that beyond the workplace, living and working in the UK comes with its own cultural challenges. You might find differences in lifestyle, work-life balance, and social expectations. Taking the time to understand these aspects will not only help you professionally, but also make your personal life here much more enjoyable. So as we move forward, I encourage you to be open-minded, embrace this opportunity, and learn and adapt. The NHS is a system that's consistently evolving, and flexibility is a key. You may face challenges, and there will be moments when things feel overwhelming. But remember, you're not alone on this journey. There are many support networks both within the NHS and among your peers, and I am here to provide you with all the insight and tools you will need to thrive. Now keep in mind that every overseas doctor who has walked this path before you has had to go through the same learning curve. With time, patience, and persistence, you will find your place in the NHS. And in the next videos, we'll be exploring specific scenarios and case studies that will further illustrate the importance of understanding the UK medical culture. Together, we'll look at how you can not only succeed, but excel in your role here in the UK. Thank you for being here, and I look forward to guiding you on this journey to success. So stay tuned for the next sessions where we'll continue diving into the details of adapting into the NHS and making the most of your experience as an overseas doctor. Let's start the successful journey now.